And welcome to this edition of Heartland Cares, a monthly program about the HIV and AIDS services that we offer here in Paducah and Western Kentucky and Southern Illinois. I'm Andrew Halford and I'm the Executive Director. And with me today is Leslie Travis. But before I start the conversation with Leslie, I kind of want to go back and connect us with our previous program, which focused on an introduction about Heartland Cares since its inception 15 years ago. And in that particular program, we talked about housing as being one of the most important parts in creating the foundation of care for us at Heartland Cares. So one of the things that I've been thinking about in the last month and that I have created is a graphic that you're going to see that has the triangle of care, with the top of the apex of the triangle being the medical care that our clients receive, and then the foundation being outreach and case management. And outreach is a very important part of what we do at Heartland Cares, because one of the things that we're concerned about is the continuity and the consistency of care. One part of outreach is prevention. The other two parts are education and community awareness. And prevention is a very important step in the whole HIV/AIDS continuity of care. And in that particular program, we offer an oral quick so that a person who wants to be tested can come to Heartland Cares, receive a test that is free, anonymous, painless, and the results we have in 20 minutes. And in that 20-minute wait period from a swab of the mouth comes an opportunity for a trained staff member to discuss HIV and AIDS with this person, to kind of give some counseling. And then if that test at the end of the 20 minutes is negative, of course, you're on your way. If it's positive, then the other test that we have is an extensive blood test that just confirms the positive test of the oral quick. But here's the important thing for that positive test at Heartland Cares. A person who tests positively for HIV is immediately taken into care. We have the two best infectious disease doctors, I would say, in the Southeast. We also have a nurse practitioner, a full-time nurse practitioner, and a full-time RN and a CNA on our medical staff. So immediately that person is enrolled into care to make sure that there is that consistency and continuity. Now, here is another very important part of that foundation, that base for this triangle of care, and that is the case management. Last time we talked about housing. Today we're talking about medical case management. So I have Leslie Travis with me this morning, who is the medical case management team leader. Leslie, it's good to have you with us.
Good to be here.
And I look forward to your sharing what medical case management is and how important that is to the continuity and consistency of care. Mm-hmm. Now, medical case managers are like navigators, but there's obviously more to medical case management than just navigating. So what is a medical case manager?
It's a broad term that describes a variety of services and ways to assist a client. Depending on the setting the medical case manager works in, you might be facilitating their referral to another physician or specialty care. Our setting is unique in that we're funded through the Ryan White grant, and our goal is to make sure the client has the ability and the stability to take their medications and be a partner in their health care. So we might be able to assist them with obtaining or maintaining their housing. We work in conjunction with Steve Clark and his department that was here on the last program. We help them. The biggest focus is their medications. HIV medications can be up to $2,000 to $4,000 a month, and that cost would prohibit the vast majority of Americans from being able to access them.
Exactly.
We have a program in Kentucky called ADAP, It's the AIDS Drug Assistance Program, and through that, as long as you're a resident of the state of Kentucky, you have a positive HIV test, and you make under 400% of the federal poverty level, we're able to assist you with the cost of those medications.
Okay. So many people might assume that a medical case manager is like a social worker. So what's the difference between being a social worker and being a medical case manager?
Social workers also have a holistic view of their clients. When we do have a social worker on our staff, you have to have a little bit more specialized medical knowledge than the average social worker. We need to be able to educate and support clients with the regimen of medications they take for their condition. It's a little more, it's just kind of a specialty. Our medical case manager is a little bit different than the other roles that most social workers would have. We deal with a chronic disease, so we have a long-term relationship with our clients, and it is very client-focused.
Okay. Now, what's the importance of the medical case manager to this whole continuity and consistency of care?
One of our big focuses is what's called retention. The process you described of coming in and getting the OraQuick test and then moving on to the confirmatory test, we can walk the client through that, establish a relationship, make sure they have our number so that they can contact us with any questions. You know, it's difficult and often shocking news for people to hear. And with the experience we have, we're able to help them see that they can live a healthy life, that they can, you know, be productive citizens, and that this is not a death sentence. In doing that, we make sure that if they don't come to a medical appointment, if they don't get a refill on their medication, that we can give them a call and try to see what's going on. If it's an issue that we can assist them with to support them in their life, to help them get back into care. That's one of our big focuses. So we are, like I said, a partner in their health care to make sure that they continue to take the best care of themselves that they can.
Okay, and I know you've just recently, you mentioned this confirmatory test and also the OraQuick. You just returned, what was that, a week ago from a statewide testing or training session for testing. What was the important thing about that final piece of training for you in terms of being able to test?
It was a good opportunity. Greg Lee hosted that training, and he's been with the state, I think, for 15, 16 years.
Exactly.
So he had a wealth of knowledge, and it was an opportunity to sit down with other professionals, share some experiences, do some role playing, so that you would be prepared for the different reactions that clients would have. I've had to deliver difficult news to clients in different settings, and I always try to have them focus on the fact that you had the virus yesterday, but today you have the knowledge to take care of yourself.
Ah, good.
And the reality was there, but now you have the knowledge and the support that you'll need to navigate this disease and to be able to be as healthy as you can.
Exactly, exactly. You know, you and I have talked about this quite a bit. I've always been very impressed with your professional and your academic background. So just talk a little bit about what you bring to Heartland Cares as medical case management team leader in terms of your academic preparation and your professional experience.
My original degree is in psychology. I have a bachelor's in psychology with a double minor in child development and criminology. I started working in a residential facility for youth with mental health problems, and I saw that the nurses really got to have a level of interaction that I thought I would enjoy. I came back to Paducah and received my associate's degree in nursing here at the community college, which was a wonderful experience. And one of the things I like so much about nursing, I love to learn. I love education. And there's a ladder of education. You can work and continue your nursing career that way. And I received my bachelor's degree from McKendree University. They have a distance learning program in the Southern Illinois, Western Kentucky area. I enjoyed that very much. I've worked as a community health nurse. I've worked as a home health nurse in public health, and the majority of my nursing career was spent as a psychiatric nurse. I've always been fascinated by mental health and the challenges that population deals with. And I think it was a blessing, the background and experience I have to come into this role. Many of our clients deal with substance abuse issues, mental health issues, and I'm not afraid to ask people if they're, having suicidal thoughts. That's something that our clients do struggle with, and we're able to meet them where they are. We're comfortable with those questions and those type of situations, and we all come together kind of like a puzzle. We all have different experiences and backgrounds that allow us to support each other and our clients.
Okay, that's good. And I think that's one of the interesting things about your experience is that you're able to navigate within all of the facets of care, because you've had the home health, you've had the psychiatric, you've had the medical background. So you really have this unique foundation that allows you to do that kind of navigation. Now, on your medical case management team, is there one particular academic, professional preparation that's more important than another one?
I think the person's belief about care, at this point the state mandates some of the requirements that an entry-level medical case management person would have, and ideally that would be a bachelor's degree. It could be in a variety of fields: social work, nursing, psychology, counseling, even education, because that's such a huge part of what we do. For me as a team leader, I want people on the team who are client-focused, who aren't judgmental, who can meet people where they are regardless of their background or their lifestyle. We deal with homeless clients. We deal with people that have just had a really tough way to go in life. Some of our clients have been incarcerated, so you need to have an open mind and an open heart to deal with them in a way that they feel comfortable with. And I think our staff does a wonderful job of that.
So on your staff of 3, what are their backgrounds? What were their preparations for?
Our most long-term staff member is Nancy Rye. Her original degree is in psychology. She's worked for the state of Illinois and in other roles with family preservation and different things, but she's been at Heartland Cares for 10 years, so she has a wealth of knowledge about the grant, which is incredibly important.
She does.
The different software programs that
Yes.
we use and tools like that, and she is amazing with the clients.
She is.
Her knowledge of the medication regimes and the way they've changed over the years, she can help answer their questions. Why is this different now? Some of our clients are more interested in those kind of questions than others, and Nancy meets them where they are.
And that's very important while we're here with Nancy. That's very important for the piece of the continuity of care that you were talking about, which is adherence.
Yes.
Okay.
The best way I've heard adherence described is every day that a client takes their medication, it's like building a brick wall. And for every dose you miss, you've left a
Great.
gap where the virus can bounce around on that brick wall and find a way through.
Come through that mortar that
Yes,
is
that little gap.
that glue.
And so the more you miss, you can see that the wall would be weak. Where if you take your medications
great
every day,
analogy.
you have a
Great
really strong wall. And that's what's made the AIDS virus, the HIV virus, so difficult to develop a vaccine and treatment for, is the fact that it mutates.
Okay.
So that was an interesting part for me, even as a registered nurse, to learn was 2 partners that have HIV can have different strains of the virus. So
And they can
protection
still
and
infect
prevention
each other.
at that point is even still critical for them, and that's surprising for people to hear.
Yes.
It's an interesting virus.
It is,
and
it
it
is.
acts in interesting ways within the body. So
Exactly. So there's Nancy.
we have Miss Keisha Curry. She's the newest addition to our team. Her background is in social work. She was an employee at Western State Hospital, so she also has a psychiatric background, but also worked in adoption preservation with families in crisis. And our families are often in crisis, either with the diagnosis or with the stigma and the impact that it can have on their lives. And she's wonderful at meeting clients where they are in that realm. She's a single mom to 2 wonderful kids, and she's just a really dynamic and beautiful person.
She is. She is. She is.
And then we have Tammy McManus, and she's been at Heartland Cares for a number of years. Her background is as a CNA, a certified nursing assistant. She came from different medical offices, so she has a wonderful background in navigating the healthcare system from the referral perspective, being able to educate clients on the tests that they need to go have. I think one of the most amazing things about our doctors and our facility is their desire to be their primary care physician.
Yes, it is.
As infectious disease doctors, it's not a role you would typically see them assume, but we make sure our clients have total care, whether it's they're due for their annual exam, colonoscopy, maybe the client's having some osteoporosis issues. There can be side effects of the medications they take. So Tammy may work on, making sure the client has a referral for a bone scan, an MRI, respiratory assessment. And she is so talented at talking to office staff and saying, this is a client who has a history of cancer. We really need them bumped up. She advocates for them in a way that is so personal. I know most of us had experience at doctor's offices, not receiving a return phone call,
Exactly.
having balls dropped. And Tammy is awesome at following through on every step of the procedure.
And I was thinking about that just as you were talking about that particular position and that particular person. And I think we have put a label with that. We hate labels, but triage.
Yes.
Case manager, and talk about what this triage case manager does.
She's really the liaison between the medical and the medical case management departments. She has the first contact with clients. If an individual moved to our area or if they were a new diagnosis,
she's the intake
She's
person.
the intake person. She completes and enters the initial intake. And that's a very stressful and challenging role. This person may be very upset about their diagnosis. They may have had past experiences with other healthcare providers that are negative. And Tammy has such a warm and welcoming and calming demeanor that she's able to ask very difficult questions in a way that's not judgmental and allows the client the opportunity to answer these questions and be comfortable. And I think that's a huge blessing.
Yes, it is. Yes, it is. One of the things I think that we pride ourselves on is as we talk daily and in our meetings as staff, that we're holistic, that we are, sometimes I hate this expression, but a one-stop shop. I mean, we talked about that at the community college for years about being a one-stop college, and being able to navigate through it. But for us, that's really a very important thing. And you talked about this uniqueness that we have at Heartland Cares, where our infectious disease doctors that are so specialized in their training and in their knowledge are willing to take a step beyond that and become the primary care. What's the importance of our holistic approach to HIV?
I think it's an amazing component of the care we provide. Many of our clients deal with poverty. Many of them are disabled and receive a very limited income. Transportation is a challenge, especially in the rural areas that we serve. We serve such a wide demographic and geographic area. If clients had to find transportation to come for 3 appointments, the majority of them would not be able to do so. To be able to come at 9 o'clock on a Tuesday to see their physician, to see a nutritionist, to see a mental health therapist, to meet with their medical case manager, to stop into the housing department, with a few phone calls to establish and set up those appointments. They can come in one day for one trip. We can also assist them with the cost of gas to come into the clinic. If they have a medical card, we can assist them through the Medicaid system with their transportation. That's a huge challenge in our community, is the ability to get where you need to be.
Exactly.
Gas has become so expensive. Used to, if you live in Wickliffe, to come to Paducah for a medical appointment has become a $20, $25 trip.
Exactly.
And where your neighbor might have used to been willing to do that, they may not have the financial resources to do so. Our clients have the unique challenge of not wanting to share why they necessarily need this medical care. So being able to do that anonymously. We also partner with a cab service in our area. And that's something I think that's interesting too, through our grants and our review system that we've stepped our game up on, is creating MOUs and BBAs with these other agencies so that they're giving us the assurance that they'll treat our clients' information with the same level of confidentiality that we do. And that's a good feeling for us.
Exactly.
We take that of the utmost importance.
And you talked about our wide service area. We serve, 17 counties in western Kentucky? So it's not just the Purchase area.
That's right.
We also serve the counties in the Pennyrile area of Kentucky.
As far as Muhlenberg and Todd County, and
we have clients in Bowling Green, don't we?
we do.
Okay.
The state of Kentucky is broken up into 6 regions as far as the HIV/AIDS coordinator services, but clients can petition for specific reasons to travel to other areas. And we do have some clients who've chosen us over some other sites and choose to come to Paducah to receive their services. Bowling Green, with their large college system, they don't have a clinic like ours.
No, they don't.
Their residents have to travel to either Henderson for their care, Nashville, or Paducah. I think it's kind of a hidden gem in Paducah to have this level of specialty service available for our residents. And we also offer a satellite clinic in Hopkinsville, Kentucky once a month. We're blessed to have St. Luke's Free Clinic there partner with us, and they provide free office space since they're closed on Friday. We travel there with a full staff. Every
Once a
discipline,
month.
and
Once a month.
every discipline that's needed goes on that trip. We go tomorrow. We meet at the clinic at 6:30 in the morning, travel to Hopkinsville, and we're
And you're
serving
there
clients till we're done.
Yeah.
As many clients as we need to serve. Dr. Carl Laboon sees the clients in the Hopkinsville area, and some of those clients travel an hour and a half, from
Even
their
to get
homes,
there,
even to get there.
Yeah.
Western Kentucky and the Penny Riley, it's a large rural geographic
It's a large
area.
geographic area. It certainly is. And that's really interesting. You mentioned Henderson because of the 6 agencies in the Commonwealth of Kentucky, there are only 2 of us who are truly holistic.
Standalone, all services.
That's
Yes, sir.
that's a better way of saying instead of one-stop shop. We are a standalone. But the difference between Heartland Cares and Matthew 25 in Henderson is that we do have the infectious disease
Yes.
doctors on staff with whom we contract. They're not full-time with us, but we contract with them for hours during the week for their care. Plus the fact, don't we contract with them for emergency room care 24 hours a day, 7 days a week.
And that to me just illustrates the dedication that they have to the clients they serve.
Exactly.
I don't know of any place else that has on-call 24/7 coverage from 2 infectious disease docs for a community our size.
Yeah.
It's really amazing.
And and you and I have talked about this, when we've had folks come in to do site visits, particularly from Part C, which is the medical grant that we received, they're just amazed, and they say this can't be, because they're used to being working with New York and San Francisco and Chicago and
those
Miami.
clients don't have this level of service.
No, they don't. No, they don't. No, they don't. So that's really very important. I think that's.
And especially too, you have a client come into the emergency room. We had a situation in the last 6 months or so where a client needed a certain level of care, but the physician in the emergency room had not as a full understanding of HIV care as our docs do, and they were able to direct them to a level of care that was appropriate for them. They're able to offer education to the staffs at the local hospitals and facilities. Even medical personnel with infectious diseases sometimes have misnomers or myths that they believe about the condition, and our doctors are able to go in and provide that education and support to staff, that our clients don't need to be treated any differently.
Any differently from any
Universal
other client,
precautions.
any
All
other
patients
patient.
should be treated with the same level of care.
Exactly. Now, can medical case managers, are they available to all the clients who come through Heartland Cares?
They are available to be assessed. If you make over a certain income, depending on your family size, you're not eligible for our services. If we have clients, you mentioned the Part C grant, the medical grant.
Yes.
An individual has the right to choose their medical care from any facility they want. We have clients who travel from Alabama, Tennessee, Missouri, strictly for their anonymity. They feel more comfortable coming to a medical clinic that's not in their own community.
And this is for their medical
For
care.
their medical care. Versus their medical case management care, it's based on where you reside.
Okay.
To
It's
be
geographic.
a client of those services has to have a Kentucky identification or a utility bill, a lease, something in their name that identifies a Kentucky address within our geographical region.
Okay.
And like I said, there are the potential to have exemptions to that, but they're pretty limited.
Okay. So that's the reason that we don't take medical case managers to our off-site in Carbondale.
Those medical case managers are provided from the health department in Illinois. Each state gets to set up how they receive the federal funds from these grants.
Exactly.
In Illinois, it's through the health department system. In the state of Kentucky, the governor has done it through the Office of HIV/AIDS in Frankfurt. So ours is administered slightly differently than the Illinois system.
Right. And of course the Part C, the medical side, is done nationwide.
Yes.
So that's also important. So it doesn't make any difference where you live.
No.
If you need that level of care, then you can request that
Yes.
your records be sent to that particular place. Let me end on this.
Okay.
What is, and you've been the team leader now for a year.
Yes, sir.
So, and congratulations.
Thank you.
That's great. That's great. God, this gives me chills. What if you were to choose one event, one situation that kind of stands out in your mind as being one of the most significant for you in this year, what would it be with a client?
The birth of an infant,
Ah,
not positive.
okay.
We have an amazing record at Heartland
Yes,
Cares
we
that
do.
every baby that has been delivered to one of our clients has been negative.
Yes,
And
yes.
that the pride and the hope, you know, that gives me, the ability to tell other clients, you know, that we've had 9 babies born, you know, that we have moms who deliver healthy. You know, if you're committed to your health care and you will partner with us, we will be there for you and make sure that this pregnancy turns out well. And for a child to come into this world with the hope and the health status that means is just so valuable.
Exactly, exactly. Leslie, thank you so much for being with me today and for your passion and for your professionalism. It's a pleasure to have you
Well,
at
thank you
Heartland
for having me. I'm
Cares.
glad to be here.
And thank you for joining us for this presentation of Heartland Cares.